identifying those patients who would benefit from genetic testing for mutant LDL receptor genes, which cause familial hypercholesterolemia, is advantageous. This would help diagnose members of the family who might share the same mutant alleles, and also identify those who would most benefit from cholesterol-lowering statin drugs and other treatments, especially important since the first symptom that many patients show of their heart disease is that they undergo myocardial infarction and die. And so therefore, there is great benefit to testing individuals who would benefit from diagnosis. However, not everyone can be tested. The cost would simply be prohibitive. And so therefore, potential patients need to be screened as to who are likely candidates to have these mutations before the testing is done. And so first, a pedigree would be analyzed. Those individuals who suffer from familial hypercholesterolemia are likely to have a number of relatives which also suffer from the disease. And the disease would seem to follow a dominant disorder inheritance pattern in which it does not skip a generation. There are potential complications in that you would have to screen for all of the symptoms, since some of them, xanthomas, might develop later in life, while women might be less likely to undergo myocardial infarction but have high blood cholesterol levels. That cholesterol levels might be affected by medications that someone was taking, say, to lower cholesterol, and so therefore no one symptom might be definitive in identifying who in the pedigree would be characterized as carrying the disease. Once one identifies those who are likely candidates given this inheritance pattern, one would screen for other potential causes of hypercholesterolemia other than mutations in the LDL receptor gene. So, for example, one might do a thyroid scan, a liver function test, perform urinalysis, and screen out individuals who might have lipid disorders for other causes. Once these individuals are screened, then one could perform the genetic test looking for mutations in the LDL receptor gene. Unfortunately, more than 1,600 are known, and so therefore frequently the genes are then sequenced to try to identify which specific mutation is present in this patient.